Hi, everyone. Thank you for having me. And thank you to Ruth for putting this together, and Susan as well. As Susan stated, I am a Lyme disease patient. I've had Lyme disease for the majority of my life, though I wasn't diagnosed until 2017. So I went 33 whole years just having progressive health problems and not really knowing what was up, but into adulthood feeling like there's got to be an explanation. It's not just that, oh, this organ doesn't work right and this one doesn't either and this other thing is wrong, but they're unrelated. Because I kept getting individual diagnoses, which is a very common refrain that I've heard among Lyme disease patients, because it's not the easiest thing to get diagnosed with. Finally, I found a doctor who listened to the long list of my symptoms, none of which would improve with the treatments for each individual diagnosis. And he said, I think you have Lyme disease. Have you ever been tested for Lyme disease? And I was like, I don't have that. I've definitely been tested. I definitely don't have that. Fortunately, he was persistent and very curious and got me to do the test anyway, and tested for multiple tick-borne infections, which was really important. And the results came back positive. And so I started treatment, and my life definitely changed around that time. I'm going to talk about Project Lyme. We're going to talk about Lyme disease. We're going to talk about tips for prevention, symptoms, and what's going on in the broader Lyme disease community and the needs that exist and that are working to be met. So Project Lyme's mission is to eradicate the epidemic of tick-borne diseases through awareness and education, support of cutting-edge science, and advocacy for solutions to end patient suffering. I'm not sure that everyone is aware of this, but Lyme disease is, as alluded to earlier, actually, a multisystemic infection. It's a bacteria that can affect every single joint, tissue, and organ in your body, which is partly why it affects everyone a bit differently. Most of us, we all know that it comes through a tick bite, the main tick responsible being the blackleg tick or deer tick, though it's not the only tick or vector, as we call them, like a mosquito, tick, or a flea. A vector is something that can transmit any sort of pathogen from one living thing to another. It's a spirochete, which means it's in a spiral. It's very common. But there are lots of different tick-borne infections, which we'll get into in a little bit. And sometimes people just refer to Lyme disease as tick-borne infection. So we have to do a little bit of myth busting here, because yes, the majority of people who become infected with Lyme disease become infected through tick bites, but Lyme infected ticks can be found on more than just deer, unfortunately. So it's mice, squirrels, and birds, which is part of what we're going to explore about how Lyme disease is more prevalent, more prominent, more endemic than we might have thought. Another myth that we get to bust is something about transmission time. Sometimes people think that if a tick has only been attached for a tiny bit of time, that they can't get Lyme disease. But unfortunately, that's not true. So there's no known minimum attachment time. And on top of just the tick bite, you can get a variety of other transmitters like flea bites, mosquito bites, mite bites, and sometimes in utero, there's congenital Lyme, so a mother can pass it to a child in the womb. So more myth busting. Lyme disease is not specific to one area of the country or even the world. There's we talk about endemic regions, we talk about seeing deer, but I can give you an example. I know it's still the Northeast, but people rarely expect it. I got my most recent tick bite in Central Park in New York City, and there are plenty of places where you can get a tick bite, and so it's really important that we bust this particular myth, because if we really want to make efforts to stay safe, we should at least know where to do it, along with how. Because Lyme disease is everywhere except Antarctica, because it can survive year round as long as the temperatures are above freezing. So that, yes, that's why knowing how to protect yourself, to recognize symptoms, and find medical professionals who understand, like LLMDs, as we discussed, the Lyme literate medical doctors, is crucial. So Lyme disease is extremely common. The CDC reports that there are 476,000 new cases of Lyme disease in the US every year. That doesn't reflect long-term cases. That doesn't reflect people who remain sick or have false negatives. It's brand new cases reported every year. It's the fastest growing vector-borne infectious disease in the US. So it's really important that we're talking about it, because there are people here who have Lyme disease. And if you don't have Lyme, you almost certainly know someone who has Lyme. And this kind of conversation is what helps us get to the bottom of it and prevent it from being such a huge problem. So this is really gross to me, because as a Lyme disease patient, I don't love ticks. That may shock some people, but it is really important to be aware of what to look out for. So ticks can vary in size, from the size of a peanut to the size of a poppy seed. And you can see from this graphic, there are different stages of development of various ticks, and they will be of different sizes. The last one that I saw that was brought in by my brother and sister-in-law's dog, most likely, was the tiniest thing. And so I was glad I was able to see it moving. But it is very important to know that it's so small, which is part of why people don't know that they've been bitten at least half the time. So this is a slide with lots of helpful information, and I would be happy to share this with you after the fact, because it's all about prevention. If you wear light colored clothing, you probably already know this. You seem like a vigilant, aware group, but just in case, wearing light colored clothing, long sleeve shirts, long pants. You can tuck your shirt into your pants and tuck your pant legs into your socks, and wear boots with the pants tucked in to kind of prevent the ticks from being able to crawl up and get into your skin. You can spray your clothing with something like DEET or permethrin, which are really good insecticides and repellent. And, be aware of your surroundings. Like, speaking of not wanting to go outside, I'm not someone who you'll find in tall grass probably ever again. Normal grass, maybe, but avoid tall grass and be vigilant in the woods. It's safer, though not impossible, to get bitten, but it's safer if you stay on paths and sidewalks. And with that in mind, just knowing that it could be in your front lawn and in parks like Central Park, any park, just to be aware, so that when you've gone outside and you come home, you can at least check properly. You can dress accordingly when you're going to go outside, period, and you can check properly and give yourself a little more sense of like peace of mind, knowing that you've taken care of as much as you possibly can. So there's more tips about things like walking in the middle of trails and staying away from low bushes, leaf litter, and like grass that may be coming over from the side into the trail. Avoid sitting on logs and wading through leaves. Again, about wearing light colored clothing, treated clothing, tall socks. And I definitely do this once you've come inside from any place outside. I do this from any place outside, but some people might just do it if they've gone to the woods or something. Whatever you want to do is fine. But to change your clothes, you can toss them in a hot dryer and shower within 2 hours of coming inside, and do a tick check. And you'll see on the right side of the screen how to look, where to look, preferably in the shower and within 2 hours of being outdoors. You can check your head and hair, your feet, your toes, basically any crevice. And if you find a tick, you can use tweezers to take them out. And as it says, disinfect, grab it, and consider putting it in a plastic bag and sending it to a testing facility. And if you're interested in doing anything like that at any point, you can go to projectlyme.org to get exact instructions on how to do that. Whoops. Okay. So if you get bitten, or if you think you might have gotten bitten, you may have these symptoms. This is what we call acute Lyme disease. It's when someone has contracted the illness immediately, and it may present as flu-like symptoms like fatigue, fever, enlarged lymph nodes, headaches, muscle aches, joint pain, stiff neck, a rash, and Bell's palsy, which is facial drooping on one side of the face, and some other things that are really similar. Just if you feel like suddenly you've got arthritis and swollen joints, and if the joint pain migrates, then it's very likely. And also problems with your short-term memory. Here are some more tips really quickly about staying safe at the park, camping, and at the beach. Believe it or not, it's important to be vigilant at the beach. The instructions are really similar, to be honest, in each place. You can treat, if you go to the park or the beach or camping, you can treat the things you bring with you, like your blanket, your tent, etc., with permethrin, and avoid sitting directly on the grass. Dress pretty much the same way. Maybe not at the beach, but I think that we can understand about how to dress in a way that protects our skin. And then when we get home, to do the same protocol as we would anytime about changing clothes, taking a shower, and doing a check. Okay. A little more myth busting and a little more just possibly new information, because we've all heard of a Lyme rash, but it might not be exactly what you think. So I'll have some pictures on the next slide, but we probably all have heard of a bullseye rash. And I know for myself, I was expecting it to look like an exact target, but they don't always look like that. However, if you get a bullseye rash, you have Lyme disease. You don't actually need to test. That is a telltale sign. But not everyone who contracts Lyme disease will get a rash. And there are multiple types of rashes. Those are the three most important points about rashes. Otherwise, they're not particularly itchy, they might be painful, and they might feel warm. So if you have a rash that resembles any of these, it's worth getting checked for Lyme disease. However, fewer than 50% of Lyme disease patients recall having a tick bite. Ticks are tiny, as we've discussed, and not everyone gets a rash. So it's really important, if you suddenly have symptoms and they sound and look like Lyme disease symptoms, even though you may not have had a rash, it's very likely that you have Lyme disease, considering it's so prevalent. So it's worth looking into. Now, this is also gross to me, but I really wanted to share this with you. There are multiple types of Lyme rashes. I wish I had known this as a child. I truly do. There's the classic bullseye, which you can see, but then sometimes it can look red or blue, or all red, or be patchy, or just be a blister in the center, as opposed to looking like a bullseye. These are all manifestations of a tick bite. I saw as a child, and I can tell you that so many people, now that I know so many people in the Lyme disease community, I hear this probably every day. So many people said, I thought it was a spider bite, but it was a tick bite, and we just didn't really know what to look for. Another very important point is that rashes don't look the same on everyone. Most medical textbooks will show you the bright red against very light colored skin, but not everyone's skin is like that, for varying reasons, actually. Ethnicity and race being one, but also just anything your skin might do. There's lots of reasons why. And that's another reason people also miss their rashes, even when they do have them. And it's a big part of why minority populations don't get diagnosed as often, because the rash doesn't show up on their skin as medical professionals are taught to expect. And so that is a really, really big problem for all of us, honestly, because who are not being tested and treated, and there are people who are getting sick and need help, and also we're not recording our numbers properly, so it doesn't really help anyone. So, how many people here have heard of chronic Lyme disease? No. This is a thing. Well, I as happy as one can be to talk about a chronic infection or a chronic condition, I'm glad we're talking about it now. I'd like to explain it, because we talk about Lyme disease being multisystemic, as it is, and it is. That means that it really changes your body when it's been in your body for a long time. So if a Lyme diagnosis is missed or delayed, the illness can progress to what people would call a late stage Lyme or a persistent Lyme, in which ongoing, widespread, and multi-systemic symptoms are present. And that's where I fall into the mix, because I don't have the exact same symptoms as I did whenever I was first bitten. It's been in my system for a very long time, and my symptoms are now graduated to other things. And unfortunately, sometimes when people do catch it right away and they treat it right away, they still end up having symptoms, because it can survive against antibiotic treatment, and because it affects everybody differently, sometimes it's the right combination of antibiotics and other types of medicines that we just don't have the exact testing for, and every doctor will have a slightly different protocol. And sometimes you get people, for whatever reason, you often get people who have developed a long-term illness from a single tick bite. And with this long-term illness, there are recurrent symptoms. And currently, there's no cure for that, though plenty of people through treatment go into remission, which is a great goal to have and gives people a really high, wonderful quality of life. So there's plenty of hope for, I would never say anything is hopeless, and there's plenty of hope for someone like me or anybody who's dealing with this long-term illness. Remission is a great goal to have, in my opinion. I'm so happy to be working with Project Lyme, because they're funding research to develop a cure and continuing to push forward in research and funding research and advocating for patients, because we need long-term solutions, and it's a more complicated problem than we would all like it to be. So the symptoms of chronic Lyme disease are very different from the symptoms of acute Lyme disease. Some of the early stage symptoms might remain, like joint pain especially, and headaches and all of that. But several new ones emerge because the bacteria spread throughout the body, and that's going to be a little bit different per person. And this list is all of the possible symptoms that could be impacted, and depending on where the Lyme is really attacking you, that will affect how you feel. So a lot of people end up with neurological symptoms like cognitive impairment, sleep problems, mood changes. You can have cardiac symptoms. You can have endocrine, musculoskeletal, all sorts of things. And it can become extremely serious. I developed very serious neurological symptoms as a result of an untreated infection for such a long time. It became extremely complicated. And yet I feel that I have to at least share this with you, because otherwise it sounds extraordinarily dire. It is extraordinarily dire. I had a brain injury as a result, and my short-term memory became like 10 seconds long, and I was not able to speak. But I was treating Lyme disease through finally the right combination of antibiotics, other medications, IVs, and now I think I'm speaking in full sentences. And and I'm here. I wouldn't have been able to do any of this before. So there are plenty of treatments out there that have been able to bring people back from truly the brink. So while it's really important to know how serious it can get so that we're vigilant and we're helping people who need help and helping ourselves, it's also really nice to know, I think, that there's something on the other side of that. One thing that Lyme disease is often called is the Great Imitator because it mimics its symptoms because they're so kind of all over the place depending on how it gets into your body. And because it's so all encompassing, it can actually mimic other conditions. So it's often misdiagnosed. So you have a lot of Lyme disease patients who get misdiagnosed with fibromyalgia, MS, lupus, myalgic encephalitis, which was formerly known as chronic fatigue syndrome, autism. Like if you look at this graphic, you can see all of these symptoms, so like the flu-like symptoms, the fatigue, the muscle and joint pain, the brain fog, sensitivity to sound and temperature, neck pain, back pain, carditis, etc. Those overlap in other diseases and other conditions. And so what ends up happening a lot of the time is that the patient will be diagnosed with this other thing, but the medication or the treatment that they're given for the other thing is unsuccessful because that's not actually the root problem that they're dealing with, which is why it's so important, even though you have medical care, to be under the right care and given the right treatment. And by knowing what you actually have. That brings us to testing, which, as we've discussed, is not the easiest thing. It can be really difficult to determine who has a tick-borne illness. There, as we talked about earlier, laboratories have different levels of sensitivity, specificity, and cost. The CDC's diagnostic criteria and recommended testing process miss about half of the actual cases. So often a clinical diagnosis is necessary based on the symptoms that we've discussed. And specifically, if you wonder whether or not you have it, it's going to be smart for you to get tested for a co-infection, which we'll discuss soon, because ticks are gross, as also discussed, and can transmit a variety of pathogens at one time. There's lots of information about this at projectlyme.org. So if you're interested or if you're wondering, I would highly recommend going to the website. A co-infection. So one tick bite can transmit a variety of other harmful illnesses because they're just gross and they carry all kinds of bacteria and viruses, etc. at once. These would be called co-infections. The list here, like Babesia, Bartonella, Ehrlichia, etc., are some on a long list. The presence of those, if you get tested and you test positive for those, you will, that's kind of a loophole that I found for understanding that you've been exposed to tick-borne infection, because often a doctor will test you with a Western blot and it will be CDC criteria negative, and you'll assume that you've had no exposure to a tick bite. However, if they tested you for some of these, one of these, you might have a positive result because that testing is a little more sensitive, and then then realize that the cause of your symptoms could be not only these co-infections, but Lyme disease, because Lyme disease is not we don't have a blood test. We test our blood, but Lyme disease lives in the tissues. So we have a problem of testing for the moment. The symptoms of these co-infections are sometimes overlapping with basic Lyme and sometimes different. So their presence can make the condition a lot harder to treat. And again, that's why it's just so important to get as specific as possible. And to get back to this, treatment for Lyme varies from patient to patient. It depends on what stage of the infection you're in, if you've just gotten bitten, or if you're like me and you get a couple decades under your belt before you get diagnosed, and how severe your symptoms are, the presence of the co-infections we've discussed, patient's age, and other clinical factors. It is very smart, if you know you've been bitten by a tick, to do prophylactic treatment, like just to take the antibiotics for a certain amount of time, just in case, because it's the long-term illness. I cannot stress this enough, is just not worth it. So, as you've seen already, Lyme disease is an increasingly common infectious disease. Just last year, the CDC estimated 300,000 new cases in the US per year, and it bumped that up this year to 476,000. It's just great that it's more accurate, but it really shows us that it's on the rise. Currently, despite this reporting, the NIH, NIAID funding, the research only allows $63 per patient in research, which is much less than what's allocated for much rarer infectious diseases. Like, as you can see in the slide, West Nile and malaria get thousands, tens of thousands, or $100,000 per patient, as opposed to $63. And this doesn't bode well for Lyme disease patients who currently have to pay out of pocket for long-term treatment. But there are groups who are working on this. And so we're getting into the negative parts now, and then we're going to come back to what's being done and what can be done to take care of this. I'm very happy that Project Lyme is working to change this. Most of the people that I deal with on a regular basis, one way or another, are doing their part to change this situation. Lyme Persists is one initiative that we're working on with Project Lyme. It's an educational, shareable thing to explain how Lyme disease can survive against antibiotic treatment. Certainly the antibiotic treatment that the CDC recommends, and it's a call for further study, for greater understanding, and for better development of treatment plans. I may have already explained this, but this is very important because symptoms can linger despite antibiotic treatment. There's approximately 10 to 20% of patients treated with a short course of antibiotics, a couple of weeks, who will end up experiencing long-term symptoms. So currently you can do everything right and still end up with a long-term problem. And we need to share this with people so that we all make a call together for better research and better identification of optimal treatment, because right now that has not been determined. And one of the ways that Project Lyme is working on this is through this Lyme Persists campaign, but through several others, which I'm happy to share with you. Project Lyme funds a great deal of research, primarily to a group called Bay Area Lyme Foundation, and which is a wonderful research group. We have regular events, specifically online webinars, to educate the public on all areas of Lyme disease, from symptoms, treatment, how to deal with it in a COVID world, how to deal with it in a potentially post-COVID world, etc. And we've gotten awards, like financial gifts, to continue to promote research. They co-founded an advocacy group called the Center for Lyme Action, which creates a yearly fly-in to your representatives. So this year was virtual, and it was my first year participating, but it was wonderful because it's a national group with people from all over, not just from Project Lyme, but individuals who cared could come together and get matched up with people from their representative's office with specific talking points and specific asks to make legislative change so that perhaps one day these kind of treatments won't be out of pocket for patients, and so that the diagnostic criteria can change. My favorite thing that Project Lyme does, though, is um, that it created a space for Generation Lyme, which is a community that exists to empower Lyme disease patients. I'm excited. I'm going to be talking a little bit more about that in a few minutes. Project Lyme does plenty of events, and you can see here that they're all different and all really useful. So sometimes you'll have an event about a specific symptom, like if your eyes are having trouble, we'll have experts come in and talk about why that is and the variety of treatments. And half the time, patients just feel crazy. They're like, I got a tick bite and suddenly my eyes don't work. And this happened years ago. Why? And so much of this work just validates that it's real, that what they're dealing with is real, and that there are solutions. There have been plenty of informational pieces, webinars, et cetera, done about the similarities between long haul COVID and long haul Lyme disease, and how to deal with Lyme disease when you're pregnant. We did an awareness community building concert. So we're doing plenty of things. Project Lyme also has a gala. So Generation Lyme, a program, an initiative of Project Lyme. It's a community built to empower young people facing Lyme disease. And it is run by a small team. There are 4 of us on the board, and we work very hard to provide a safe space for Lyme disease patients and their loved ones where they can come and feel supported, connected, and inspired. What we do is we host meetups. We don't do that alone. We have our team hosting and people from the community hosting for all kinds of people. And we share patient stories to spread the word and give patients a voice. And it can be very, very eye-opening and also relieving to share what you're going through. That was a video that we made this year to really tell everyone what we're here for and what we're doing, and that they're not alone and that there is hope. And if you're interested, this is how you can help. It's very simple. You can go to projectlyme.org and learn more, get information to share, more information. If you want to subscribe to the newsletter to stay up to date, that's a great option. And there's always the option to donate money, donate time, or just to keep all of this in mind. And most importantly, to continue getting the most up-to-date information about how to keep yourselves and your families safe. And these are the sources for this presentation. All right. Does anyone have any questions? For sharing that. It's been an interesting experience as a lone patient specifically to say something like that, because it's kind of hard to fathom until it's happened to you. So anytime anybody else just echoes this, we're like, I think a step closer toward getting that understanding that we need.
I found it really very educating, this session. Thank you so much, Jennifer. And the fact is that I know now that when I do go out, I have to be really careful. In the back of my mind, it's not going to happen to me. But to take those precautions, but especially when you come back in, to really check yourself over and to take that shower afterwards. I mean, it's so easy to get. And I
Very sorry to hear that. They're welcome to reach out to me individually if that would help. And both of them have a place at Generation Lyme. The parents meetup has been really useful because it's hard on the caretaker as well. And so patients who are parents and also parents of patients who have a space to talk. And yeah, I know how hard it is. And I guess I got very lucky that I fell into a community the way I did just by being at home and going on Instagram and putting out, looking at other people's Lyme disease stuff, and I ended up making some friends that way. And then it turned out there was a whole group dedicated to making that a daily activity. So.
But it's great that you're such an advocate, that you reach out to the community and try to help people. That's amazing. Yeah. So.
It's needed.
Yeah, it is.
Reach out to me as well, and I'll do my best to help connect you with the right doctor. That is one of the biggest hurdles that we all have. And the more work we do, the more help we can try to provide. But I understand, and I'm sorry that you're in this situation right now. I've been there myself. Lyme, as we discussed, along with Project Lyme, because there's the medical side, which is so important, but then there's also the emotional day-to-day side, which is gets just as impacted by the condition. And
exactly.
So people really need both.
And may I ask you a question, another question, Jennifer?
Of course.
You know, my age group, I'm 75. And, you know, are they kind of, you know, you talked about younger people. I'm just wondering, you know, is there, can I look forward to some relief even in my age group?
I don't see why not. I don't have an easy answer, unfortunately, and this comes up all the time, which is part of why we're at the stage of advocating for so many different things related to the disease. And I see it as like pre-polio vaccine, everyone knowing that's a thing, having a plan for that, and now we're post, and polio is not such a problem anymore. Same with smallpox. This will eventually be that. We're just not there yet. As far as what you've said, and that's why you're right. What you've heard is correct. Antibiotics are not a problem-free solution. They can mess with your gut. It's always a question. It's a cost-benefit analysis to try something and see how you feel. There are more options than just antibiotics. Some people do herbal protocols. Some people do other types of IVs like ozone, which I've done. I mean, a lot of different things have helped me, and it's not just antibiotics. Though for me, antibiotics have made an enormous difference, which has not been kind on my digestive system. I just take a lot of probiotics, but it's been really helpful to just about everything else. So for me personally, it was worth it. And that's why what's the expression? We've described this, especially in Generation Lyme, as something kind of like, it's a throw spaghetti at the wall and see, like throw things at the wall and see what sticks.
Yeah, I get it. Yeah, sure.
Something this important to be like that. That's where we are, and it's like that for each person. Some person might get lucky in the initial stages of the treatment and get it. Someone will get it right for them right away, and the next person with the exact same circumstances, but like one tiny biological difference, will try the same thing, and it'll end up taking years for them to find something that really makes a difference. But that whatever that combination of things is out there. So this baseline not good feeling that you have is not how you have to stay.
Yeah.
And for that, I wish I had a better answer.
Appreciate all your knowledge and your, you know, all your information and willingness to help so many people. Really great.
I have to say that it's definitely not just me. I've never been around, there are so many people that I have met who have dealt with Lyme disease, who have found whatever energy whatever energy they have to helping other people in some capacity, whether it's telling their story on social media, to working with a nonprofit, to creating a nonprofit, to advocate, to anything. Like any and all the things in between. It's
Mhm.
an incredible group of people because it's a difficult, as you know, long-term problem that everybody deals with differently. And because it's poorly understood, it's very hard to deal with. But there are so many people out there who are providing really, really amazing efforts, even small ones, just because people have limited energy to make a difference. And it's pretty special.
Well, I mean, just for myself, it was an excellent presentation. Thank you, Jennifer, for sharing your story,
Definitely.
as well as all the information on the different initiatives you're working on. It was very informative, I thought, and
I agree.
I just, think, I just figured a tick bite, a rash, then, and it's a lot more than that. So I need to be a lot more careful because I am a hiker. So, and I tend to hike during the seasons where ticks are active. So, I need to be careful. Okay. So if no one has any other questions, I think we can say goodnight.
Thank
Mhm.
you all so much for having
Thank
me.
you so much. Yeah.
Thank you, Jennifer. It was excellent.
Thank you so much.
It was really good.